Good morning, everyone. Let's get started with today's session. The session has been put to recording. Today, we are learning about the forward bending postures and some key points which will help you to practice your postures better and also help to teach others properly. So, diving straight to the session without taking much of your time. Just a second, there is some technical issue. Great. So, coming to today's session, learning about forward bending postures. If at all you have any questions, you can ask at the end. Before we start, let us know the important muscles which you will come across while you are dealing with the forward bending postures. The group one called as quadriceps, which you are well aware of. It is in the front of the thigh and it has four muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Then coming to the second group, which is called as hamstring, which is there in the back of the thigh. It has three important muscles: the bicep femoris, semitendinosus, and semimembranosus. Okay, now coming to the inner thighs, which has five important muscles: adductor longus, adductor brevis, adductor magnus, gracilis, and pectineus. Now coming to the outer thigh, which are called as abductors, the three important muscles: tensile fascia latae, gluteus medius, and gluteus minimus. And of course, for arms, you are well aware of biceps, deltoid, and triceps. For back, you are aware of trapezius and the paraspinal muscles, erector spinae, the rhomboids near to the scapula, levator scapulae near to the scapula, latissimus dorsi on the mid back on the both the sides. And of course, the abdominal muscles, which are four: rectus abdominis, external oblique, internal oblique, and transverse abdominis. So these are the important muscles which you will come across throughout the session. Let's have a visual understanding of these muscles. First, let us watch the important muscles. You can see from the top iliacus, next to it is pectineus, next to it is psoas major, and then you have adductor longus, which is the adductor muscles. Then there is a long muscle of the body, which is called as sartorius. And of course, one near to the inner thigh, you can see over here, that is gracilis, that is on both the sides. Then I was telling you about the abductors, which is tensile fascia latae. Then you have the quadricep in the front, where you can see rectus femoris, vastus medialis, vastus lateralis. At the same time, vastus intermedius, it is below the rectus femoris, so it is not visible over here. Coming to the next group, the hamstrings. You can see the important muscles, hamstrings over here, the bicep femoris, semitendinosus, and semimembranosus. Again, a view of sartorius can be seen. And you can also see the adductor muscles over here. And you can also see the gluteus maximus, gluteus medius, and minimus is below it. Then the outer thigh, which is abductor muscle, which is tensile fascia latae, which is to the lateral end of the thigh. And then in coming to the calf muscles, you have the gastrocnemius muscles. So these are the important muscles. Same with the inner thigh, which are called as adductors, the five muscles. And then the outer thigh, which has three muscles, tensor fascial latae, gluteus medius, and gluteus minimus. So these were the important muscles one has to remember while we are learning about this anatomy of the different postures. Today's session is on forward bending postures. Let's go ahead and start with the first posture of the day. The first posture of the day is Parshva Uttanasana. So now to easily understand about the postures, the muscles marked in yellow are the ones which are stretched, and the muscles which will be marked in red will be the contracted ones. And the muscles which will be in pink will be the stabilizer muscles. Stabilizer muscles means muscles those are contracting. So if you see the first asana, you find that there are importantly 5 muscles which are getting stretched. One at the buttocks, second behind the thigh, third the calf muscles, and the soleus and the spinalis, which is on the back. Let's have a better understanding of this. So you can see clearly, you can see the muscles over here. While you're performing Parshvottanasana, one key point one has to remember is to keep knee slightly soft. You don't have to make it strong, and then you'll be able to stretch yourself properly. So here, make sure that you are keeping your knee soft, not pulling it up. See, you pull up your knee when you bend backwards. So while you're bending forward, you just have to keep the knee in extension, but knee should be slightly soft. So you can clearly see the calf muscles, soleus getting active, hamstring getting active, gluteus maximus getting active, and the erector spinae muscles are getting active. At the same time, you also find that anterior deltoid and infraspinatus muscle is getting active because of folding of palms behind the mid back. So this is a visual representation of what all muscles getting stretched while you are doing this Parshvottanasana. Coming to the second posture, most widely practiced, Padhastasana. Now, same key point has to be kept in mind that the knee should be in extension, but knee should be slightly soft. When you keep the knee slightly soft, your forward bending will never injure your muscles or your back, and you'll always have a better forward bending. Especially in present era where we find students are facing with the posterior pelvic tilt because of long sitting on chairs. So for them, there is always difficulty in bending forward, and you find their back gets round while they are bending forward. So in this scenario, you need to understand the muscles, but you need to keep the key point in your mind that slightly the knee should be soft while bending. So again, you have important muscles which are getting stretched over here. One is hamstring behind the thigh, gastrocnemius is calf muscles, erector spinae, again your back muscles, and the quadratus lumborum, which is there by the sides of the erector spinae. We'll have a visual view of that. So you can clearly see that gluteus maximus muscle is getting deeply stretched. Same time, hamstring and calf muscles getting stretched. But the quadricep muscles, especially the rectus femoris muscle, is into stabilizing and contracting zone. At the same time, you can also see that erector spinae muscles on the back, which is by the sides of the spine, are getting stretched in this posture. Now, let me show you the quadratus lumborum muscle. See, you can see the side view of the quadratus lumborum muscle, which is getting stretched. Earlier, I had also informed you that most of the time, the stiffness of these muscles lead to back pain. So if we regularly practice Padhastasana with knee folded, then in that scenario, it is going to help you out stretching these muscles. Now coming to the third posture, which is Prasarit Padottanasana. How many of you are able to do this posture properly and they are able to touch the head without widely spreading the legs? If you are able to do it this posture nicely, please write 1 so that I get to know that you are doing these postures nicely. Okay. Dhanraj, Dr. Archana, you can do it. Great. Thanks for responding. Great. Now, let's see the muscles which are getting stretched in these postures. Here you can see the list of muscles, which is gluteus maximus, hamstring, hip adductors are also getting involved, means inner thighs, and apart from that, erector spinae and gastrocnemius muscles. Let's have a better visual understanding of it. You can see the adductors getting active, stretch, the hamstrings getting stretched. Same time, you can see the calf getting stretched. If you're placing your arms down, your wrist flexors are getting stretched. And of course, if you can see these yellow lines over here, that is representation of the erector spinae muscles getting properly stretched in Prasarit Padottanasana. So one important key point about Prasarit Padottanasana is that it helps to stretch the hamstring as well as the adductors. So those people who have stiff back and they find difficulty in bending forward, especially while doing Padhastasana, then in that scenario, this posture can be practiced. Coming to the third posture, Ardha Uttanasana. Now, the reason of understanding this posture, so you have seen most of the forward bending postures, you have been seeing that gluteus maximus and erector spinae muscles are getting stretched. But here there is a contrary thing which is going to happen. Let's see. Here the lengthening muscle is only one, and that is hamstrings. You can see over here the hamstrings are only getting stretched. But what are the contracted muscles? So it is contracting the gluteus maximus. It is contracting the erector spinae muscles. It is also contracting the abdominal muscles. It is also pulling up the diaphragm. It is contracting the quadriceps femoris. It is contracting the trapezius over here, rhomboids, and of course, deltoid. So in this forward bending posture, you find it maximum muscles are getting contracted, and so this posture can be treated as a strengthening posture. You only find stretch at the hamstring muscles. So you can see these many muscles are getting contracted while doing this posture. The deltoid, the erector spinae, the gluteus maximus, quadriceps. So this is a strengthening posture. So if you make this posture for the students, they can do it with wall support so that initially they get support from wall to keep the muscles in a contracted phase. Later on, they can do without wall support. Coming to the next posture. See, this is very important posture and many people struggle doing this particular posture, Malasana. Because of the present lifestyle where we sit more on chairs and we don't sit on floor very often, except our yoga sessions, or suppose someone eats sitting on floor, else we don't sit on floor. So now the reason you are getting tight adductor muscles and the quadriceps is bit weak, and whenever someone is trying to sit in Malasana, their body is leaning backwards and they are falling. So now what muscles are actually getting contracted while doing this posture? Let's see. The most important lengthening muscles are the front of the thigh, the quadriceps femoris. Then you have the soleus, which is getting stretched over here. We can see over here behind the calf muscles. Then you find the quadratus lumborum getting stretched, which we have seen in earlier postures. And of course, gluteus maximus and hip adductors. See, if you don't place your elbow by the side of the knee, hip adductors won't get active. Suppose you are doing this posture keeping the arm straight. In that scenario, hip adductors won't get stretched. The placement of the elbows by the side of knee will help to stretch the adductor muscles, which you can see over here. And the body weight should be well controlled by contracting the hamstring, contracting and keeping the back muscles straight, and the gluteus medius is also contracted over here. Let's have a back view of the posture. See, you can see the quadricep getting stretched, calf muscles getting stretched. So this is excellent posture. If we sit for a longer time or if we stand for longer time, your calf muscles are stiff and your back muscles get tight. So you can clearly see over here, there's a stretch of the quadratus lumborum over here, you can see, and you can see the gluteus maximus getting stretched. So you can have a clear representation that quadriceps femoris is getting stretched. So this is one of the essential postures. Initially, if people are falling, then you can ask them to take some holding support. They can hold some part or slightly raise the heel by keeping a towel below the heels. So that will prevent falling back. So these are the measures one can adopt initially if they are not able to sit in this posture. But as a yoga practitioner, make sure that you practice this posture for 1 minute regularly. So now that will keep your so many muscles active and strong. You can clearly see over here, some part of the erector spinae getting stretched and some part is getting contracted. So recommendation to practice this posture regularly. You can see it also requires a good ankle mobility. So if you want to improve your malasana, then you need to practice ankle rotation every day, 10 clockwise and 10 anti-clockwise. And you need to practice basically mountain pose every day so that you can sit in this posture properly. So if you are able to hold your mountain pose, Parvatasana, or also called as Adho Mukha Svanasana, for minimum of 1 minute, then you will find easy to practice Malasana. So these are the posture one has to practice regularly to keep the mobility and stretchability of the body high. You can clearly see how the adductor muscles are getting stretched over here. So very good representation of how this posture is effective for us. So make sure that you are doing this posture. So hope you're now aware if what all muscles are getting contracted and what all muscles are getting properly stretched. And you also had seen the visual representation of these muscles. And this should help you. Now coming to the next posture, lizard posture, also called as Uttan Prishthasana. Now, Uttan Prishthasana is again an important posture for those who suffer from pelvic floor tightness and those who have very stiff body. Now, they should practice this to enhance and practice the advanced postures. So let's see what are the muscles which are getting lengthened and what are the muscles getting contracted. So the lengthening muscles are here is at the glutes, gluteus maximus, hamstring is getting stretched. The inner thighs, adductors are getting stretched. The psoas major, what we have seen in the start of the session, we had seen the visual representation of this muscle. Iliacus also we had seen, and of course we had been seeing quadratus lumborum since last 2-3 postures. So these are the muscles which are getting tight, and these are the muscles which often tend to be very stiff, and this prevents a lot of postures for you. So if you practice this, this will not only improve your forward bending, but it will also help you to keep your body more flexible. Now, the muscles which are getting contracted, of course, the chest muscles, the pectoralis is getting contracted. The sides of the body, serratus is getting contracted. Triceps, because you're placing your arm on the floor, so that is getting contracted. And your deltoid, and you can see over here the neck muscles, splenius capitis and cervicis is also contracted. I'll show you that in the next. So you can see over here the muscles which are getting contracted. So these are the neck muscles which are called as splenius capita and cervicis, which are getting contracted. See the positioning of the legs. It is absolutely straight. One has to take care of keeping the leg straight. And the elbow and shoulder should be always in line. Your elbow should not extend forward. And one more thing, you should understand that your elbow is in close line with the heel. So then there will be proper contraction of the chest muscles, serratus muscles, deltoid, and of course, it will also contract the triceps. Now, those who want to do push-ups regularly and want to improve their push-ups, they need to practice this posture because this will strengthen their tricep and that in turn will improve their push-up things like Chaturanga Dandasana and power yoga postures will be improved. Coming to the next posture. This posture I had earlier done in my introduction class also, but as we are dealing with the forward bending posture, I am revisiting this posture for you. So in this, the lengthening muscles can be clearly seen, the hamstrings and the calf muscles, the gastrocnemius, and the contraction is at the front of the body. So how should be your breathing? See, one gets confused that what should be the breathing while you are into this posture. So you have to make sure that you are slightly contracting your abdomen, and abdominal contraction is better when you exhale. So if we are, and we are well aware of the fact that we cannot hold the exhalation phase for a long time. So you can hold for some few seconds, then again inhale, then again contract the abdominal muscles. So this will improvise your posture. So what are the muscles getting contracted? Of course, most of the abdominal muscles are getting contracted. And you have the psoas major over here getting contracted. You have quadriceps getting contracted. Of course, the outer thigh, the TFL, transfacial latae is also getting contracted. Sartorius, the longest muscle of the thigh, is getting contracted, and the diaphragm. So if this is also a strengthening posture, like we had seen Ardha Uttanasana, which was a strengthening posture. Likewise, in Ardha Uttanasana, what we were doing in standing, it was strengthening the back muscles and the gluteus muscles. Now, when you are doing the same kind of posture doing in supine, you find the front of the body getting more contracted. So again, this is a great strengthening posture. But if you find that you're not able to keep your knee straight, in that case, you can slightly soften your knee and it won't hurt your back. Coming to the next forward bending posture, which is called as Supta Padangushthasana. Supta Padangushthasana is basically for lengthening at the soles, calf muscles, hamstring, and simultaneously the psoas major muscle and the iliacus muscle. So this is more like a preparation for doing advanced postures. If you want to improve your halasana and you want to make it smooth, then this posture is one of the important pre-posture so that you can improve your halasana and you can improve the duration of your practice. You can hold halasana for more than 2 minutes if you're able to do this posture for at least 30 seconds to 1 minute. You can see the visual representation, how the psoas major and the iliopsoas is getting stretched over here. And rest of the muscles which are marked in yellow can be easily seen, which are getting stretched. And the muscles you're seeing in pink are basically the stabilizer muscles. Here you can see the quads is getting contracted, tibialis anterior getting contracted, gluteus maximus getting contracted. And here, of course, you can see that the forearm muscles and the biceps getting contracted. So again, a stretch posture helping to improve our forward bending. Clear representation, the stretch of plantar flexure, gastrocnemius, hamstring. Now, when you are well aware with the fact what all actual muscles getting affected, it is easy for you to design your sessions. Coming to the next posture, halasana. And that's why I have kept halasana after this posture. So if you improve Supta Padangushthasana, you will be able to improve your halasana. So what are the muscles which are getting lengthened? The maximum muscles are getting lengthening in this posture. Visually, what you can see right now is the hamstring and the calf muscles, and again the plantar flexus. Over here, you can see. You can also see the pectoralis getting stretched. You can see the erector spinae muscles. You can also see the neck muscles, which is splenius capitis and cervicis. They are getting stretched over here. So now, if you can recollect, while we are doing standing forward bending with Ardha Uttanasana, those muscles were getting contracted. Now this is a complete stretching, a great posture. And of course, this is good for quadratus lumborum because most of the people have a very stiff quadratus lumborum muscles. You can clearly see how fully the erector spinae muscles are getting contracted in this particular posture. That makes a very effective posture. You can see how the hamstring, side view of the muscles, which are getting a good stretch in this posture. So we are aware that back of the body is getting stretched, but you should be actually aware which all muscles are getting highly benefited. And now you have a clear visual view of those muscles. So that should improve the way you teach yoga postures or you practice yoga postures. So you can clearly see in Halasana, the chest is also getting stretched. Hamstring, gastrocnemius. So a great understanding of this posture. Let's move to next posture, which is again strengthening posture. You know it as Nauka Asana. And as of now, the only muscle getting stretched here dominantly is the hamstring. And the muscles which are getting contracted can be clearly seen here, the abdominal muscles, all the abdominal muscles, all the four abdominal muscles. How do you remember it? Remember it as a term, TIRE, T-I-R-E. T stands for transverse abdominis, I stands for internal oblique, R stands for rectus abdominis, E stands for external oblique. Then the contraction of the psoas major muscle, iliacus muscle, sartorius, the longest thigh muscle, and of course the outer thigh, it is getting strong, but quadricep is getting strong, and of course diaphragm, your breathing capacity is improved. So here also you have to maintain a slight inhalation. You should not completely contract your abdomen, especially at the navel. The reason, if you do that, what will happen? There will be load on your low back, and people tend to complain of back pain frequently because of practice of Nauka Asana. And the reason is they contract their lower abdomen in a very high grade. Instead of that, keep slightly in an inhalation mode, slight inhalation mode active, and then you'll never experience back pain while doing Nauka Asana. If you have people have experienced, or if your members or patients have complained to you of back pain because of Nauka Asana, just keep in an inhalation phase. This will help them. Let's have a better view over here. You can see the rectus muscle, abdominal muscles, the psoas major muscle, which is in the front of the body, and it is getting proper contraction. Let's have a deep view of here. You can see the rectus abdominis muscle, which is getting contracted. You can see the psoas major iliopsoas over here, and you can see the quadricep muscle over here getting contracted. So just trying to show you the best possible view of the muscles which are into action while doing Naukasana. So this is, see, you don't have to do many exercises, but you have to practice few in a better format every day. That will definitely help you to improvise the overall strength and flexibility of the body. And especially Naukasana is a complete strengthening. It's a great posture one has to practice every day. Now, again, we have dealt with this posture earlier in the introduction session, but I'm repeating it again because again, this is a forward bending posture and you find there is a stretch of the inner thighs in this particular frog posture, also called as Mandukasana. So here, the muscles you see in pink are the stabilizer muscles. That is, abdominal muscles are stabilizing, the chest muscles are stabilizing, the serratus muscles are basically getting stabilizing. But lengthening muscles are the inner thighs, which are called as adductors, gracilis, and pectineus, which are getting a deep internal stretch. So those people whom you have seen while doing butterfly, their knees at very high level, especially the very stiff people who have recently started with the yoga practices, for them it is sometimes difficult to practice butterfly and that causes back pain for them. In that scenario, practice of frog pose should help them to stretch their inner thighs and improve their flexibility. Coming to the next posture, which is Marjari Asana, we have completed the standing series of forward bending. We have completed the supine series of forward bending. Now we are coming to the prone series of forward bending. So now this is the posture which is widely advised at the start of your yoga session, Marjari Asana. The reason, see, while you are in an inhalation phase, it is contracting the erector spine and stretching the abdomen. But while you are into exhalation phase, it is contracting the abdominal muscles and stretching the erector spinal muscles. So basically, this is a neutral posture. So if you start your yoga practice and you find that your back muscles are stiff, or suppose there's a morning stiffness in the body, and some people frequently suffer from back pain, or they suffer from the quadratus lumborum tightness. In that scenario, this Marjari Asana helps to activate the erector spinae muscles. See, while you are doing a stretch over here, the erector spinae is beautifully getting stretched. And the contraction of abdominal muscles and the glutes can be seen over here. And the serratus muscle over here. And of course, you can see the tricep also getting stretched, contracted. So in inhalation phase, there is a contraction of the back muscles and stretching of the abdomen. Exhalation phase, all the spinal muscles till neck, till that splenius capitis, what we were talking about, cervicis, what we were talking about, is getting a good stretch. So this can be done at the start of the session. And after that, you can start with all the joint loosening practices. So if your back is stiff, or you have members or patients coming to you with a lot of back pain or stiffness, you can start with two things. One is the frog pose, and second one is this posture, Marjari Asana. Coming to the another view of understanding, see how the serratus muscles are getting contracted, how the triceps getting contracted, and at the same time, the stretch of the spinal erector muscles. Spinal erector muscles are nothing but which helps to keep the spine straight, or to help to maintain its S-shaped curvature. You know, your spine is not straight. If spine gets straight, then that is condition is called as ankylosing spondylitis, also called as spot spine. So S-shaped spine is maintained by the flexibility of the spinal muscles. And that's why we suggest to practice this Marjorie Asana to prevent your spine getting straight. You have always heard of this term loss of lordosis in the back for people who sit for longer time. Well, um, not going into much of the pathology part over here, just trying to explain you about these postures as we have, and you can see clearly the rectus abdominal and the gluteus maximus getting contracted while doing these postures. So that's about Marjorie Asana. Now coming to the most important posture, most of the people make mistakes over here. They are not able to understand where they should keep their focus. Now in today's session, let us learn that where exactly the focus should be there while you are doing Parvatasana, or also called as Adho Mukha Svanasana, also called as mountain pose. Now, if this is base posture, base posture, if this is good, if you have experienced Ashtanga primary series by Patabi Joish or BKS Iyengar ji's format, their prime and the base posture is downward dog, Adho Mukha Svanasana. And some people struggle to keep the heel on the floor, or if they are able to keep their heel on the floor, they are either bending their knee or they are modifying their back over here. Let me tell you the key points while you're doing this Parvatasana. The key point number one, the key point number one is here the importantly contracted muscles are the deltoid, triceps, and the serratus anterior muscle. You can see the red over here. And of course, in the back, you have contraction of the trapezius. There is a contraction of transverse abdominis, which where I am marking the arrow, and of course the quadriceps. But what one has to focus on? One has to focus on keeping the thumb and the index finger strongly on the floor. You need to press your thumb and index finger strongly on the floor while you're practicing Parvatasana. At the same time, you should contract your shoulders to your best and keep the triceps strong. Some people don't contract the quadriceps, deltoid and tricep, and that's the reason there is no proper lengthening of the spine. So you can see over here, there is a stretching of the abdominal muscles and the stretching of the latissimus dorsi over here. You can see this yellow muscle where I am moving the arrow. And this is the latissimus dorsi muscle. Now this muscle is getting stretched. The front line, the abdominal muscles are getting stretched. So if this is also getting stretched, front and back both are getting stretched, then the strength should be somewhere around the shoulders. And if you don't keep the strength over here, you will never find stretch in the front. You may find stretch at the low back, but you may not find the stretch at the front. So this is very important thing one has to focus on. You can clearly see over here the muscles which are getting contracted, deltoid, triceps, and serratus anterior. Same time, you can see here the trapezius getting contracted and the quadriceps getting contracted. And the muscles which are stretched, of course, the calf muscles, the hamstrings, the latissimus dorsi muscles are getting stretched. Now here I have tried to show the close-up of contraction of the deltoid, tricep, and the serratus muscle, and of course the quadriceps femoris. But you can see the pectoralis major is stretched, rectus abdominis is stretched. Rectus abdominis is stretched, but transverse abdominis is contracted. So you have four abdominal muscles. So in four abdominal muscles, transverse abdominis is contracted, but rectus abdominis is stretched. So now this is one of the great understanding one has to keep. while doing the Parvatasana. Let's move. I would like to show you how the trapezius, lower fibers of trapezius are getting contracted to keep this posture into active format. Just a visual representation of the muscles which are getting active. Coming to the next posture, Sashankasana, also called as child pose, also called as Balasana. This is basically a stretch posture. Where it is stretching, it can be clearly seen that the erector spinae muscles, the gluteus muscles, the quadricep muscles, and the tibialis anterior are getting a great stretch. So this is normally done after a backward bending postures, especially Dhanurasana and post Bhujangasana and Shalvasana. But this can be practiced by people who suffer from a lot of back stiffness because of long standing or long sitting. This is one of the essential practice after Marjari Asana. What they should do is they should first practice Marjari Asana. After Marjari Asana, they should practice this child pose. After this child pose, they should practice the frog pose. And after frog pose, they should practice Parvatasana. So, see, I'm not only teaching you about the anatomy of the muscles, but I am also telling you the sequence, how actually the postures can be practiced. So that should help the person with the back stiffness. You can also see here the quadratus lumborum muscle is also getting stretched in child pose. So it helps to release the back pain. Coming to now sitting series of forward bending postures. So as of now learned standing, supine, prone, now to the last few postures, which is in the sitting series. In first posture we have taken is Janushesasana. So Janushesasana, you can clearly see the back of the body getting stretched, right from neck, erector spinae, gluteus maximus, hamstring, calf muscles. Now, I have to show you something interesting over here. What's that interesting? Let's see it. The interesting part is the quadricep of the straight leg is getting contracted. The hamstring is getting stretched. But what happens to the another leg, which is folded? So what happens to that leg? So if you see the folded leg over here, what you will see, the adductor muscle of that is getting stretched and gluteus medius is getting stretched. This is of the folded leg. See, of the straight leg, what we have seen, straight leg, we can see that calf muscles, hamstring, gluteus maximus, and spinal erector muscles are getting stretched. But the folded leg, there is a stretch of the inner thighs, the adductor muscles, and of course, the gluteus medius muscle. In this posture also helps to stretch the quadratus lumborum. Initially, slightly knee can be kept soft. Then there will be proper stretch to the quadratus lumborum muscles. Coming to the upper version of Janushesasana, that is called as Paschimottanasana. In this, you can clearly see that it is called as Paschimottanasana because all the posterior muscles of the body are getting stretched. So it is self-explanatory by name. Still, to know, there is a stretch of the plantar flexors, the calf muscles, the hamstrings, the low back muscles, and of course, the erector spinae to all levels. And you know, there'll be contraction of quadriceps. By now, you have learned that the quadriceps get into active mode while you're doing a forward bending posture. So that's a clear understanding of the Paschimottanasana. Beautiful stretch to calf, hamstring, buttocks, erector spinae. This erector spinae are the stiff muscles. You can see the quadratus lumborum over here. They are doing a forward bend. These are the erector spinae over here, and here you can see the quadratus lumborum getting stretched. Now coming to a very less practiced posture, which is Triang Mukh Paschimottanasana. Here one leg is folded laterally, externally, and another leg is straight. What happens in this scenario? In this scenario, you can see that if you see the folded leg, you find stretching of the quadricep and the tibialis anterior over here. And for the straight leg, everything same will happen as if it happened in the Janushesasana. So only here the change over here is the folded leg is folded externally. In Janushesasana, it is the adductor muscles, inner thighs, which was getting stretched. And now in this Triang Mukh Paschimottanasana, the quadricep and anterior muscles are getting stretched. So this how you can do variation in the posture while you're taking yoga session so that around the thigh muscles can be properly stretched simultaneously. And of course, for the straight leg, you are aware that calf muscles, hamstring, and the erector spinae is getting stretched. That is same as Janushesasana. And if you see the Triangmukh Paschimottanasana, you can also see that quadratus lumborum and the erector spinae getting proper stretch. So this is the one of the best thing you can do variations while practicing yoga postures. So finally, to the end of the session, apply your knowledge to your class taking and self practice. Just a second, I have to take a call and then I'll get back. Okay, thank you everyone. So sorry for that interruption. That was urgent, so I had to take that. So that was about understanding of forward bending postures. Great. So Dhanraj is saying that I felt great doing Halasana and Karnapidasana after the practice of Ekpad Sirsasana. Is that quadratus lumborum is the reason? Yes, yes. So if you have any questions, you can ask. And if there are no questions, we can conclude with the session. Okay. So I think we can conclude the session for here. So I thank you all for joining today's session, for taking up this precious time to understand about the yoga postures. We have a question regarding the certificate. We have separate courses for providing the certificate. you need to enroll into those courses to get the certificate. This is just a learning session where we are trying to teach you about the anatomy of the yoga postures so that it makes your self practice and yoga teaching easy. And if you want to get this certificate, you can contact us through the group number. If you are already in the group, that's fine. If you're not in the group, please drop a message to this number. They will help you out. You can write down this number. You can drop a message to them. They'll help you out. Fine. Thank you so much. Let's end. Have a nice day.